Hi, this short video is an invitation from your premier dental laboratory, Aesthetic Dental Arts. In today's world, there are so many premier dentists whose practices are either not growing or maybe even actually declining because they're not getting enough new patients. Now, your premier dental laboratory that brings you the latest products, the latest procedures, the latest technology, they've sent you this video so that you can learn about something called 4D Dentistry, where you can build your premier practice using the internet. So, what is 4D Dentistry? I'm Dr. Gary Sanchez, and I developed the 4D Dentistry process, and I'd like to explain it to you today so you can see if this is something that you could utilize to build your premier practice. Now, 4D Dentistry is an invitation-only platform. So we only take a couple of dentists per month because we want to make sure we do a great job for each dentist. But I want to explain to you what it is we do and what 4D Dentistry is. First, let me tell you just a little bit about what we do. At 4D Dentistry, we help premier dentists build premier practices. And the way we do that is by helping them get new patients because we believe that it's the right new patients that are the lifeblood of every successful dental practice. Not just any new patients, but the right new patients. So, what is a premier dentist? If you're a premier dentist, you know who you are. You're somebody who's spent a lot of time, a lot of money, a lot of effort going to places like the Pankey Institute, the Dawson Center, LVI, OBI, Spear, Scottsdale Center, MISH, courses like that. You've spent a lot of time to develop yourself into a premier dentist. And I know this because I'm one of you. When I got out of dental school, we started a Dick Tucker Casgold study club at my practice. We started an aesthetic study club where we would fly in whoever was the best at what we were trying to learn. We'd fly them in and they'd work with us hands-on, kind of over-the-shoulder type thing. We had Bill Dickerson for 3 years. We had Larry Rosenthal for a couple of years, David Hornbrook for 3 years. We had Michael Miller. Whoever was the best, we'd fly them in and they would work with us. Then I went through the Pankey Institute. I learned about bioaesthetics at OBI. I went through the Schuster Center. I took docs courses, endo courses, ortho courses. You name it, I took it to become a premier dentist. And in my practice, I thought that taking all these courses would help build my practice. And what I found was people didn't like to talk about their teeth. And so from the outside, it looked like I had a very busy practice because I had a lot of patients, but most of them were completed. And so they didn't need anything, and they weren't going to need anything for a long time. So I wasn't getting enough new patients to fill my practice and to keep us building. And I practiced with my brother, Greg. And so for both of us, we were getting between 8 to 12 new patients a month, and it wasn't enough. So one night I was sitting at my desk after work, and I had this epiphany. I was trying to figure out which course I was going to take next. And what I realized was I didn't need another technical course. I needed more new patients. The new technical course wasn't going to bring me any new patients. And so I needed to figure out a way to get more new patients. And specifically, more of the right new patients. Because it's too costly to have the wrong patient come into our practice. And if you're a premier dentist, I'm sure you have the same type of new patient process that I do. And to have the wrong person come in is too costly. I can't spend the time that I would like to with somebody who shouldn't be in my practice. And so what I did is I started to study and train with the best in internet marketing. Guys like John Assaraf, Simon Sinek, Jeff Walker, Ridgely Goldsboro, Hubert Lee, Brendan Bouchard, Mike Koenigs, guys that had built million-dollar businesses using the internet. And so I went to all their courses, I did webinars after work, and I implemented the best practice strategies that I learned from these guys. And it really worked. We went from 8 to 12 new patients a month to 30 to 40 new patients a month. And this has been going on now for over 20 months. Having the right new patients and having an abundance of new patients just transforms your practice. It makes it so much more fun to have people coming in that are looking for what you're offering. So, what is 4D dentistry? I took what I learned and I divided it up into the 4 Ds: D1, D2, D3, and D4. So let's start right into it. D1. D1 stands for define. Defining your practice. You'd be surprised how many premier dentists haven't really defined exactly what type of practice they have. Are they looking for a sedation practice? Are they looking for a cosmetic practice, an implant practice? What type of practice are you trying to build? And you've got to get crystal clear on what type of practice you're trying to build, because that will lead you to define your ideal new patient. Now, when you market online, and pretty much when you market anywhere, you want to be clear on who your ideal new patient is so that you can speak directly to them. Because each type of ideal new patient is looking for a different type of practice. Somebody who's fearful and hasn't been to the dentist in a long time is looking for a different type of practice than somebody who's a cosmetic patient and is just wanting to look better. So we got to become crystal clear on who our ideal new patient is. So that's D1, defining your practice and defining your ideal new patient. D2 stands for drive, driving visitors to your site. Now there's ways to use SEO, social media, the radio, mailer, whatever you're using. You have to have a way to drive visitors to your site. If you've got a great converting website that's on the 5th page of Google, when somebody searches for a dentist in your town, you're not going to get any traffic, and you're not going to get any visitors, and you're not going to get any new patients. So you've got to have a way to drive visitors to your site. So we've developed the right strategies to get your practice to the first page of Google so that you're going to get enough visitors, and you're going to get enough traffic, and you're going to get new patients. So once you've got enough visitors coming to your site, you've got to have a way to deliver your ideal new patient to your practice. So you've got to have the right messaging that speaks to your ideal new patient, that lets them know that you are the practice for them and you are the right dentist for them. So you've got to have the right messaging to attract the right new patients. Let me give you an example of what I'm talking about. In my practice, our ideal new patient is somebody who hasn't been to the dentist in a long time, has a lot of dental needs, is fearful of going to the dentist, and is now ready to get something done. Their life has been affected by having bad teeth, and they're ready to get something done. Let you listen to a radio spot that we use that helps drive people to our practice and to our website.
At Sanchez Dental Associates, we believe that life is better with great teeth. We also know that there are so many people that are living below their potential. They are living a life of quiet desperation because of their teeth. They're embarrassed or they're in pain. They don't like to smile. They don't like to be social. They really aren't living. This usually happens because of fear. So our vision is to give these people their lives back. And the way we do this is by providing a safe, pain-free experience that alleviates their stress and allows them to get the smile they've always wanted. They can be who they were meant to be, and that's what we do. I'm Dr. Gary Sanchez. Give us a call at Sanchez Dental Associates, 268-2741, or visit us on the web at sanchezdental.com.
So can you picture our ideal new patient driving down the road and this radio spot comes on and they're saying, they get me. That's the practice that I'm looking for. That's who I want to go see. And every day I get new patients that come into my practice that say, I heard you on the radio and I went to your website and I saw the videos on your website and you are the guy that I've been looking for. I am so glad I found you. When you start your relationship with a new patient that says that to you, you know you're going to have a great relationship with them. So using videos and using audio, we can speak directly to that ideal new patient. Now, no matter how good your website is, and no matter how good your videos and how good your messaging is, there's still going to be those patients that are not yet ready to pick up the phone and call you. They're not yet ready to make a decision. So you've got to have a way to stay in contact with those visitors until they're ready to make a decision. And that's D4. D4 stands for DRIP, or DRIP campaign. So using video, we stay in contact with visitors until they're ready to make a decision. So the last thing that we say on our homepage video is, and for coming to our site today, we put together a free gift for you. We put together the 20 most frequently asked questions that a dental office gets. All you've got to do is put your name and email in the box next to us, and we'll send them to you. So every 2 days, they get a video from us answering the questions that they would have. Now this does 3 things. It educates your patient about you, it turns you into a local expert, and it lets your visitors get to know you. So they'll know your philosophy, they'll know why you do things in your practice, and they'll know real quickly whether they like you or not. So if they make an appointment to come in and see you, you know it's going to be a great relationship. So those are the 4 Ds. D1, define your practice, define your ideal new patient. D2 stands for driving visitors to your site. D3 is deliver your ideal new patient to your practice. And D4 stands for DRIP campaign, staying in contact with visitors until they're ready to make a decision to come see you. So let me ask you a question. What's the first thing that happens when somebody gets referred to your practice? You're right. They go on the internet and check you out. That's the first thing that I would do, and that's the first thing that I do when I'm looking at a new business. So you've got to have a great web presence, a web presence that will deliver your ideal new patient to you. If this is something that interests you, and you want to talk to us about building your premier practice using the internet to attract your ideal new patient, all you've got to do is give us a call for a free consultation and see if we have any spots available. The reason your premier dental laboratory has sent this to you is because we have reserved a few spots for each premier dental laboratory for our 4D marketing platform. So we'd like to talk to you and see if we're the right fit for you and you're the right fit for us, because together we can build your premier practice with ideal new patients. So call the number that you see on the screen, call 866-247-1476, or you can email us at support@4ddentistry.com, and we'll get back in touch with you, spend some time together, and see if we're a match. We'd love to find the right dentist to work with, and we'd love to work with you if you're that dentist. Thank you very much for listening to this.